If I don't need a pap smear this year, why do I need to come and see you? So I want to differentiate between or explain what is a normal annual exam or a well check and pap smear. So annual exam or your well check is when you're coming to see us when there's not necessarily something is wrong with you, but you just want to make sure that there is nothing that you're missing at that point of time. So when you come for your well check, the first thing we do is we talk, and I try to understand if you have any health concerns going on at that time. And then depending on your age, then we talk about what is the screening test that you need. If you need a pap smear, if you need a mammogram, bone scan, colonoscopy, blood work, what is it that you need for your age? And we also talk about, let's say if you have a new partner, so do you need to get tested for that, or if there's any abnormal bleeding. So we try to just get information and make sure that we keep you in the best of your physical and your mental health. Now pap smear, so among all the tests that we do, pap smear is one part of that. It is a test which is done for cervical cancer. And a lot of people, it might sound a little technical, but a lot of women are not aware what is cervix. So everybody knows the uterus. It's a part of the body where you get pregnant, the baby grows. So the bottom part of the uterus is called the cervix. And cervix is a part of our body where there is a constant turnover or very, very rapid turnover of cells. And when there is such rapid activity going on, there is naturally higher chance of error and higher chance of cancer. So by doing pap smear, we are basically just collecting the cells from there and making sure that they are not abnormal. So that one pap smear we used to do every year, and over time guidelines have changed, and the latest guidelines are actually every 5 years if you haven't had any abnormal pap over the last 10 years. Although most of the gynecologists do, we generally do it every 3 years because 5 years seems like a longer time, and sometimes we don't see people coming back, and so we do it every 3 years. But this is just to clarify, pap smear is just a part of your well check. So even if you had a normal pap smear a year ago and you have never had abnormal pap smear over the last 10 years, so you don't need your pap smear this year, but we still recommend that you make an appointment and you come and see us so that we make sure that we keep you in good health.